Dr. William V. Williams, MD, is a rheumatology specialist in Philadelphia, Pennsylvania, with over 40 years of experience in the medical field and has worked for over 30 years in drug discovery and development. He is a graduate of Tufts University School of Medicine and practiced at the University of Pennsylvania. Dr. Williams is currently president and CEO of BriaCell Therapeutics Corporation.
Hi, this is Dr. Bill Williams again, talking to you about the risks of hormonally active contraceptives. And I want to focus in this talk on the risks from blood clots. Now, it's clearly acknowledged, even in the current labeling of prescribing information of hormonally active contraceptives, that there is an increased risk of blood clots. And this increased risk can lead to things like heart attacks and strokes, and also thromboembolism. Now, thromboembolism, that's when you have a blood clot, like in your leg, for example, and it breaks off and it travels usually to the lungs. And when it travels to the lungs, it can block the blood flow to your lungs. And then there's a section of your lung that's not working right, so you don't get enough oxygen. And that can be very, very serious. It could be life-threatening when that happens. So venous thromboembolism, it's acknowledged that the relative risk for contraceptive users is 3.5 times higher. That's a 250% increase in risk. At the same time, other types of blood clotting problems include heart attacks and strokes. And for heart attacks, the estimate is that there's a 1.6 or a 60% increase in risk. And for strokes, it's 1.7% or 70% increase in risk. Now, one of the things that is a little bit tricky in the way some of the drug developers and the drug manufacturers have labeled this on their prescribing information is that it's clearly the case that there is an increased risk of death from cardiovascular problems, that's heart attacks and strokes, with hormonally active contraceptives. And unfortunately, this is compounded if someone is a smoker. So what they've done is they've actually put in a black box warning that, especially if you're over 35 and you smoke, you really should not use contraceptives because the risk of cardiovascular mortality is so high. It's actually a 206 death rate per 100,000 women years. That's actually a very, very high rate, considering the young age of women who use hormonally active agents. But what they've done in the labeling information, they've made the comparisons look like the whole risk is from smoking. And this is just the way that they have portrayed the data, showing first every use in non-smokers and then in smokers. And that's a big difference. But what they should have shown is the control non-smokers first, and then the ever users non-smokers. And you can see that if you look at it that way, there's a approximately 4 to 5-fold increase in risk just from using the contraceptives, even without smoking. So I think the bottom line is that there is this increased risk regardless of smoking. Yes, it's definitely worse if somebody's a smoker, but overall, there is this increased risk for cardiovascular events, for venous thromboembolism. In other words, heart attacks, strokes, pulmonary embolism, and this is a bad thing with hormonally active contraceptives, and they should be avoided if at all possible. Dr. Bill Williams, thank you for listening.